Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again right here on your community station, WYAD 94.1 FM and WYADonline.com, as well as tuning in through our friends online around the world. Thanks to iHeartRadio. We're glad you guys can be with us as well. We're spending a lot of time today talking about health, and especially this year with everything that's going on with COVID-19 and our own personal safety, we've been introducing you guys to guests that we think have been able to offer some great information, but also some great encouragement for us moving forward. Our next guest is definitely no different. We're excited to welcome Mississippi's own Dr. Heath Scott to our program. I want to talk to Dr. Scott not only about his own journey of service, but also what it's been like for him this year to navigate the challenges that COVID-19 have brought about, not only for you guys as patients, but also for the staff as well. Dr. Scott is also going to talk to us a little bit about things you all need to know for yourselves to make sure that you're keeping yourselves safe. Dr. Scott, thank you so much for the time. Really appreciate it.
Thank you, Cyrus, and thank you for inviting me to be on the show. I'm really excited to help share with our community some information, and I appreciate you getting the information out there to help keep our community safe.
The pleasure is definitely all mine, and I think it's really our responsibility here at the community station to make sure that our audience is informed. Before we get into, though, how you're navigating things this year with 2020, Dr. Scott, it is your first time on with us. I want to talk about your journey to service, right? Because I think for those who are just now hearing the backstory, they'll find this interesting. Have you always known that you were a person who wanted to help in some way when it came to your neighbor and those around you?
Oh, yeah, definitely. I'm actually originally from southeast Mississippi, a town called Lucedale, Mississippi. My father was a Methodist minister and a nurse anesthetist at our local hospital, and my mom was a registered nurse that she worked in the operating room. I come from a pretty big family. There were 7 of us boys and one girl. Raised in a Christian household. Like I said, we were raised in the Methodist faith. And so coupled with that and my parents being in the medical field, I always felt kind of compelled to help and to serve. And family conversations in my house always, circulated around medicine. And so it just was a natural fit for that to be my way to help people, it was through medicine. That it was what I grew up with. It was what I knew, and it was what I was taught from early on. So, yeah, I just, started out very young. I was practically raised in our local rural hospital. I spent a lot of times up in Central Surgical Supply where they prep and wrap instruments. That was basically my babysitters, and so I've just always been around medicine, and so that's how I ended up here. And I went to the University of Mississippi Medical Center in Jackson, Mississippi, after studying at Delta State University in Cleveland, where I met my lovely wife, Leslie Roark Scott, the barbecue princess of UBON. We met at Delta State. She was with me all through medical school and residency, and I was blessed to be able to come into Dr. Thompson's practice, who had been very well established in Yazoo City for many years, and so was able to buy that practice and have been practicing there ever since, living and serving in this community the best I could.
Yeah. So I want to talk about what that's been like for you first to know those who you're serving, Dr. Scott, because I think that's going to be important as we talk about the challenges that have come this year. Do you feel like being able to be a person who is so involved in the community has really helped you to get to know those around you and those that you are potentially being able to serve?
Yes, absolutely. My field of study in residency was family medicine. I'm a board certified family physician, and that word family means family, and so I take care of the whole family from babies up to grandma. And so I just being part of the community is so important to what we do.
Right.
To really treat a patient, it's not just a bunch of numbers on a piece of paper. It's not a bunch of words on a piece of paper or an X-ray or a CT scan. It's getting to know somebody and getting on their level and really communicating with them and that's hard to do if you're not a member of the community and don't live in the community that you serve. And I originally started out right out of residency down in Florida, Mississippi, just south of here, and ultimately landed in Yazoo City. And I'm so glad that I landed here because I love this town, I love this community, and I love being part of it. And I feel I've always been welcomed into the community. I've made many great friends here. Of course, my wife has a business here as well, and she's very involved in the community. And that's just so important when you're treating medical problems. Again, you're not just treating numbers on a page or just a person. You're treating the whole person. That means physically and spiritually and mentally and everything. And so the best way to do that is to be in the town that you serve and to live there and live amongst and just do that.
Right. I think, and I know they appreciate it as well, Dr. Scott, and it's going to, I think, serve us all well as we kind of talk about now, the challenges we've been facing this year. I want to say for those who are just tuning in, it's on the radio side or online, you're listening to Conversations Live. We're excited to welcome Dr. Heath Scott to our program today. We're talking to Dr. Scott not only about his life of service, but what it's been like for him to be actively involved in the communities he's worked with now, especially where he is serving our listening audience. So, Dr. Scott, I think it is safe to say that this is not the 2020 that most people planned when it came to life. But I can believe, especially from conversations I've had from medical professionals around this country this year, that you all really are the unsung heroes. And I think I'm so glad that the attention has been shifted as we kind of think about what is looked at as an essential worker, how that I think has shifted this year, those who are really taking the lead. Could you have imagined, I mean, even though you have, as you said, you come from a family of service. You have dedicated yourself to serving. Could you have imagined that you'd be in the middle of a worldwide pandemic that is literally killing individuals almost every day, even in the state of Mississippi?
This is something that I never could have imagined, to be honest. I mean, of course, in Mississippi, we have, obviously we have a lot of poverty. We have a lot of underserved communities when it comes to medical care. And so you know that coming in, when you come to Mississippi to practice, or you practice medicine in Mississippi, you know there are certain things that you're going to have to deal with.
Right.
And so, being, treating and caring for people in our state is pretty hard anyway. And then you throw a pandemic on top of that, it just really throws everything for a loop. We see things all the time. People have no idea the number of health alerts that doctors get about, hey, look out for this, look out for that. We're just constantly inundated with stuff. And so, every time something like this, of course there's nothing been like this, but, every time you hear about, oh, there's this outbreak in China or there's so-and-so that's going on, you get this, you're kind of removed from it, so you don't really, feel pressured by it and that sort of thing. But I tell you, as this thing just crept closer to us, and even as we were seeing it, coming across our borders, I don't think we were really aware of how really bad it could get here. And thankfully, everybody has stepped up. All the hospital systems, all the doctors, nurses, nurse practitioners, respiratory therapists, everybody has stepped up to the task. But even with everybody operating at 100% capacity, their best, people die. People, you run out of room in the hospital. You run out of room in the emergency room. Can you imagine? We live in the greatest country on the earth, and have the potential of showing up at the emergency room and then not having a place to put you. I mean, we've never been in a situation like that ever, and it's been quite daunting. But the great thing about people of Mississippi and our country is we're resilient, and we fight and we work hard, and we tackle what's coming at us. And so we do a pretty good job with a lot of things. We're all aware of balls being dropped from early on as far as some of the response from the government on certain things, and we're all aware of that. But at the end of the day, when it comes to your neighbor and yourself and your community, as long as you're staying active, you're doing the best you can. We're all going to come through this, and we're all going to come through it better on the other side with God's grace and with a little bit of humility. We can come out on the other side of this, and we can actually do a better job of taking care of people. We can be better prepared the next time something bad happens. We can be more caring and loving toward each other. We can come out of this better people on the other side of this, and we're going to, because
right.
we are who we are, and we're going to take care of each other, and we're going to get through this.
And I totally believe that. I want to talk about two things before we let you go here, Dr. Scott. I mentioned to you before we went on here that I had an opportunity to interview Melinda Sawyer, who's the Vice President for Clinical Quality with United Healthcare Global. And one of the things that she's going to talk to our audience about, they'll be hearing this conversation actually after yours, is after last year, one of the things that the World Health Organization established was World Patient Safety Day. However, because of what's going on this year, they've changed it to the theme being how health worker safety is the first step toward patient safety. I want to talk about the patient safety because that's important for our audience, but I want to talk about you guys because, as I mentioned, you all are literally on the front lines of this. What has it been like for you to make sure that not only you're taking care of your patients, Dr. Scott, but also you're taking care of yourself and those working with you?
Well, at the very beginning, there were a whole lot of questions and not a whole lot of answers. And again, we were dealing with not only, a new virus that we didn't really know very much about, we were dealing with a pandemic. This is the type of thing that you study in school and you hear about and you're like, gosh, I hope that never happens to me. And then here it is at our doorstep, and here we are, having to tackle it. So that was my main problem early on, was like, okay, I'm just so your listeners know, I'm a family physician. I operate out of a clinic. I don't go into the hospital. I just only take care of patients in what's called the outpatient setting, which is just in my office.
Right.
And so my risk is not quite as great as, say, you would have an emergency room physician or something like that, or someone that works in an ICU and that type of thing. But there were so many questions at the beginning. Everything that you do to keep yourself safe on a routine basis, you have to ask yourself, is that completely different now? Do we, when they first came out and told us, hey, y'all need to be wearing masks in the office. Well, the only time a doctor wears a mask really is when they are operating on someone. And so most of our previous, or if there was, say there was a patient with a known pathogen that was something that we thought the mask would protect us, but just routine masking is not very common. So getting used to that early on and trying to figure out what works and what doesn't work, and that was the scariest thing. And so, not only from the standpoint of, keeping myself safe. I mean, I don't worry about myself. I worry about my patients. I worry about my staff. I worry about my family. Right. And with this disease, it's just been so rapidly spreading and hard to track and all that kind of stuff. It's just been really scary to think about, it's one thing if you come home with the flu and your kid catches the flu. It's one thing completely different if you come home with COVID and your kid catches COVID and you have no idea not only what's going to happen to them, but, say they go to the grandparents' house and they don't realize they have it. And so that was the scariest thing from a worker standpoint. So I started out early on, when I'd come in from work, I'd strip my scrubs off, I'd go in and I'd shower. I was just so afraid of spreading it to someone. So that was the biggest fear. And then, of course, when everybody's aware early on that we just didn't have enough of the protective equipment, and that's just something that's not fathomable. I mean, how is that even possible that we wouldn't have the stuff that we need to care for these patients? And for my colleagues that were in the hospital caring for patients that were very sick and very contagious. So those folks to not have the things they need to keep them safe was scary and daunting. And many of us physicians that are, like I mentioned before, even though I'm a primary care physician and I'm primarily in the office, we all signed up to for disaster relief. If something were to happen and say a hospital needed physicians, we were all ready to take the call and just go in. And the idea of me going into a hospital, having to go into an ICU, wearing the full gear, the whole bit, was just really scary. But thankfully numbers are starting to come down. We got things under control. It seems like the efforts of people wearing masks and trying to do all the right things has really made a huge difference. I know your listeners have heard a lot of the conspiracy theories and the negative and that kind of stuff. I'm not seeing people practicing that in public as much as you would see, as you would think, looking on Facebook and that type of stuff. And especially in our community, if you walk out, you're seeing people in masks, you're seeing people do the right things, and so that's been really that's been most helpful to us. And so, and from, since you've asked me specifically about my experience with this, is, it's very hard to go into work and completely change everything you do, how you care for patients, how you treat yourself, how you treat your office, how you do everything.
Right.
For somebody to not do something as simple as wear a mask out in public is just very frustrating. And also to see people having large group gatherings with no masking and that kind of stuff, this ain't no joke. We're working hard to keep everybody safe, and so many people turn their lives upside down, and for people to be flippant about wearing masks and that kind of stuff is just really infuriating to people that are on the front lines and supporting the people on the front lines. So, but like I said, I think the tide is changing. I think people are masking more. We're definitely seeing it in the numbers. We just have to be ready for the surge when it comes. So,
right.
So everybody just needs to keep doing what they're doing.
Well, I appreciate you sharing that personal experience with us, Dr. Scott. I'm always very careful over the years on this program. I tell everyone I feel like this program is my home. I like people to feel comfortable in my home. I never want people to feel like they're on the spot or that they have to watch what they say in my home.
Right.
It's and I when I was prepping for this segment with you, I know, like you said, there's a lot of stuff out there. That's not my job to talk about that. I think
Right.
it's our audience job to know what they need to know, and I think having individuals like yourself on to tell them that is important, so I really appreciate you doing that. So let's turn then to our audience, because there is a lot of concern out there, and I will ask you this question, and feel free to answer however you would like. As we are trying to navigate the world that we're in now, as you said, of course, masks are now part of our life. Hearing words, I don't think I ever have heard the phrase social distancing before 2020.
No. What is that?
Right. So, so there's that. But with things that are coming up, of course, people are used to, the fairs and these large events. There's all of these thoughts now that people have to consider. What would your advice be for our audience out there when it comes to, for one, protecting themselves, but also the things they need to keep in mind as they're kind of navigating the world around them?
Well, I think the most important thing to remember is that as much negativity and everything is that's out there and people feel like this is never going to end, there will be an end to this. There is a solution. God always finds a way. There's always an answer to whatever problem we have. So that's the first thing to remember is this isn't forever. This is for right now. And so, there's a lot of things that we can't do, and there's a lot of change to our life, and I get it. There are people that haven't been able to work. There are people that, while Congress is up there fighting over how much money they want to send people are suffering. And
right.
I know people are frustrated, and I know it's daunting, but, that's the most important thing to remember is that it will end. And any kind of changes that we have to do right now, we'll get back to the things. We'll get back to, hugging. We'll get back to, being in church with a large group of people singing. We'll get back to all those things. But the main most important thing that everybody needs to remember is, like I said, it will be over. After that, it's just real simple stuff. I mean, the main thing at the beginning of this was we didn't know what was coming. And so everything we've done has been an experiment up to this point. And
right.
one of the experiments that has worked has been social distancing, wearing a mask, and good general hygiene. That as scary and as mean as this virus is, as tough as this virus is, it can't stand a mask and social distance. It's Achilles' heel. And so, and something Dr. Dobbs, our state health officer, who many listeners may have seen, like on Facebook posts and talking with the governor and that kind of stuff, that he keeps pointing out is that this will be over one day, and we know that the simple things are what works. And no matter what new medicine comes out, no matter what new treatment comes out, none of it has worked as well as wearing a mask, staying socially distant, and just good simple hygiene. Now these big out, people ask, well, is it safe to do, like, say for outdoors, if we do this, is it okay? Yeah, there are certain stipulations that you can follow, and you're definitely safer when you're outdoors. But just remember, even when you're out of doors, you still need to remain socially distant. You need to be, try to keep your crowd size small. And don't be inside. Don't be inside with people. I mean, that's just, funerals and baptisms and all that kind of stuff. Yeah, that's a critical part of our life, and we all miss all that stuff, and we long for it. But it's so important. The thing that you have to continually ask yourself is like whose life am I willing to risk to go do this thing that I'm not about to go do? And so if you can't say, oh yeah, I'm willing to let my mama die, I'm willing to let my aunt die, I'm willing to let somebody in my family get very sick, then that's the question you have to ask. And I'm not trying to paint gloom or doom. I'm just saying these are the things we have to do right now, just for right now. But it all will end. It'll all come to fruition. And the other thing is, I got to remind people too that the thing people keep harping on death. Death as being just like this thing that that's the only thing you have to worry about. That's not the only thing we have to worry about. We have, we're seeing a lot of the potential of chronic illness after people have had COVID. The buzzword seems to be, people that get it and they get over it, they're fine. Well, a lot of people do, but there are many, many people that we are seeing some long-term effects from. There are many people that we're seeing, and the other thing is we don't know the long-term effects. There's many, many illnesses that we're very familiar with that we don't find out that they have these terrible, after effects until way on down the road. So not to scare everybody or anything, but again, just do the simple stuff and just stay out of crowds, stay out, wear your mask, do the smart stuff.
Right.
And another thing, listen, where you get your information from, it needs to come from your doctor, or it needs to come from the state health department or the CDC. That's where your information needs to come from. That's it's easy to get bogged down in all the info that's out there. Physicians are aware of it. We're inundated with information too, and we have the benefit of a lot of medical background, and we're aware that people hear a lot of conflicting information. But just be careful where you get your information from. Don't get it from Facebook. Get it from your doctor.
Yeah, great advice. Last thing I want to talk to you about, again, thank you so much, again, Dr. Scott, for the time, is about age. This has been an interesting thing to see the conversations taking place, and I'm not trying to get you involved in the whole thing about what's happening with school and everything like that. But I do want to ask you about age, because a lot of times people will say, well, should I be concerned about the children more so than I am about, an elderly parent or your grandparent? From what you've been able to see, what has been some of the advice you've been offering, especially even when it comes to children and then going and play with their friends and spending that time together? That's been the conversation since the very beginning. It's actually pretty rare. Usually when an illness is around, the people that are affected most are the very young and the very old. We said it 1,000 times in our clinics and that kind of stuff. And so for whatever reason, this one doesn't seem to be as bad on the young people. Okay, so that's a good thing, right? Because they don't get as sick. But it also is kind of a bad thing because the young folks are the ones that become the spreaders. They're the ones that are least likely to be symptomatic, which means they're least likely to seek care, which means they're least likely to get diagnosed, have a test done, and know that they have it. So it's actually kind of a bad thing because they can go then on and spread it. And we have seen the kids able to spread the disease around. So that's the thing with the kids is that we don't worry about them getting too sick because they just don't. But they are the ones that often will spread the disease without realizing it. And that's something really important for your listeners to know. And again, there's a lot of these things that we say we assume people have heard, but it bears repeating. And that's that, you can catch it from someone who's asymptomatic. The science is very clear. And the people that are minimally symptomatic, and this is the time of year people are showing up with colds, they've got allergies, that kind of stuff. Somebody's got a sniffle, just assume they have COVID until they can prove that they don't have it. And that's really where we are right now. So now when you get into the fine detail of what's safe as far as kids to do and that kind of stuff, that's a real tough scenario, but it's the same as everything else. As long as people are maintaining distance, they're masking and that kind of stuff, then they're okay. And then also, just be smart about it. If your kid has a classmate and they're hanging out or whatever, maybe don't let them go hang around grandma because they might give it to grandma. That's the key. The trick is just getting kids not to spread it. The main focus, and that's where we have to be. And of course, we have to remember in our community too, which is very, very important, is that of course people of color and Hispanics and all the like, that they are actually at increased risk also. So we have to be aware of you have to take a personal look at yourself. It's like, okay, what about me makes me more of a
risk, and you have to make that decision. You just have to do the right thing, which is stay at home and don't go out amongst people.
Yeah. You mentioned Dr. Dobbs earlier, and one of the things he had said in the statement to me was, and I'd heard him say it in also, I think, one of the press conferences, assume everyone has it. I mean,
right.
including children. I mean, and being able to act accordingly. I think that is the thing. I think, unfortunately, that's where we are. But I think if we're going to, as you were just saying, Dr. Scott, be able to make sure we protect those who are most vulnerable, that is the best way to be able to make sure that we're living, and again, not to live in fear, but to live responsibly. I think that's really the big thing here.
Absolutely.
Again, everyone, Dr. Heath Scott has been our guest. Great conversation with you, Dr. Scott. Appreciate you coming on and being on with us. How can our audience stay connected with you?
That's a good question. How do you stay connected with me? Well, we have a Facebook page for the clinic, Kansas City Medical Clinic. That's probably the easiest way.
Okay.
I'm in the book. We're mine and Dr. Moore's clinic is right across from CVS, behind the old Hasty Tasty. Anybody that was used to see Dr. Thompson, we have Dr. Thompson's old clinic. And so, and you just look around. I'm around. I'm in Yazoo City. I'm all over. You might catch me at U-Bonds a lot of times, too.
All right, then. I'm looking forward to that. Again, thank you so much for the time. Really appreciate it. Looking forward to having you back on the program again.
Absolutely. Hey, and again, thank you so much for getting this information out there. This is how we defeat this disease, is we educate people, and we all take care of each other, and I appreciate your efforts.
Hey, glad to do it. And we thank your audience for tuning in to another great segment of Conversations Live. As I said, stay tuned. We're going to take a very short musical break. When we come back, we have my conversation with Melinda Sawyer. She's the Vice President for Clinical Quality and Patient Safety for United Healthcare Global. We're going to talk to her not only about World Patient Safety Day, but also what it's been like for United Healthcare to be able to help during this pandemic. So definitely stay where you are. You're listening to Conversations Live right here on your community station, WYAD 94.1 FM and WYADonline.com, as well as through our friends online worldwide through iHeartRadio.com.